The Western Cape is among the three provinces contributing the most to the country's increase in coronavirus cases. There are many contributing factors, of course, to this increase, including super spreader events, which we've been talking about quite a lot in the last few weeks. So is the Western Cape experiencing a second wave of COVID-19? Let's discuss this. We're joined by Western Cape Health Department Chief of Operations, Dr. Sadiq Karim. Dr. Karim, good to see you. So we are at the end of another week. What is the latest on the spread of the coronavirus in your part of the country?
No, sure. So our total number of cases since the beginning at the moment is sitting at 114,482 cases. And we've had most people have recovered, 93.5% of people have recovered. And currently the active cases in the province are around 3,211 active cases.
All right, Doctor, and there's been this week a focus on the Western Cape because Minister Zweli Mkhize, in warning about this sudden uptick, if you will, not even sudden, but it's been a gradual uptick, hasn't it, in the infection rate since we moved to the lowest level of the lockdown, said that when we look at the 7-day average of the increase in the Western Cape, they were looking at about a 42% increase. The Western Cape, through Premier Alan Winde, then came back and said, well, not quite actually. The figures, according to the province, are more closer to 13.65%. Why is there such a big gap in those two numbers?
Sure. Perhaps at the outset, to start off with, there's often much variability in the daily data. So what we do tend to do is look at a week-on-week comparison of the data. And the critical thing is it's important to determine at which point in time the data is full, because that ultimately affects the rate of increase. When we look at the data, we look at the period of the week ending 19th of October and compared that with the week ending Monday, the 12th of October. That showed us a 13.65% increase. The National Department had looked at the weeks prior to that, and we all know that we had a very large super spreader event linked to a local bar in the southern suburbs of Cape Town. And that event alone yielded thus far 109 cases, and unfortunately 57 learners amongst those cases as well.
And how far back, just so we're all on the same page, how far back would the health department have gone then to reach 42%? I just want to make sure that we all follow.
Sure, I think it was a 2-week period, and that was exactly at the time when we would have had the southern suburbs super spreader event. So that would have taken us to this after the first week of October, so roughly 3rd or 5th of October onwards. And I think in that event as well, we also analysed that as well, to look at that event and found that most of the infections were amongst the younger people as well.
So would it be correct to say, Dr. Karim, tonight that when you look then at a 2-week period, there was indeed a 42% rise in COVID-19 infections in the Western Cape?
At that point in time, it was close to 40% from our calculations. And when we looked at it a week later, it had come down significantly to 13.65%.
The super spreader events, you had a big issue with the nightclub Tin Roof, where you got about 70 plus people who are said to have been there at a point and then later tested positive for COVID-19. Is it even possible to get ahead of that sort of spread?
It is, and I mean, in fact, I think one of the key things would be surveillance. I mean, we need to have a very active, and we do have a very active, very sharp surveillance strategy consisting of both public and private sector colleagues. And in fact, it was private sector colleagues who picked up the young adults coming in for testing, and then to rapidly have a multisectoral strategy to contain that. I think despite the difference in the numbers that we've been having and looking at it at different points in time, what we all do agree is that there has been an increase in cases, and that's been primarily our focus. Linked to that, obviously, one has to have a rapid containment strategy. Looking at the multisectoral team, and we've got different parts of government that work with us, with the Department of Health, and helping to contain many outbreaks such as happened in the southern suburbs.
What's also key then, Doc, in order to prevent events such as what happens in a nightclub or at restaurants becoming super spreader events, is that you would then rely on the owners of the establishment doing their place to make sure that patrons are spaced out adequately, that there is an enforcement of the hygiene rules and the wearing of masks where applicable. I've been out a few times in Johannesburg, and when you look around, it's not every restaurant that keeps the tables as far apart as they should be, that limits the numbers to 50% capacity. Quite often, all the tables are fully taken. And I wonder if in the Western Cape you're seeing the same as far as a lack in compliance.
We are, and obviously from anecdotal stories, and our teams on the ground have actually been reporting this to us. We had, for example, a few weeks prior to the Southern Suburbs outbreak, an outbreak in Beaufort West area. And what we've noticed has been relaxed social behavior amongst people, unfortunately, people meeting in large groups in different restaurants or even possibly just taking walks along the beach area. So I think, unfortunately, our people have begun, perhaps there's a bit of COVID fatigue that's setting in, and that is unfortunate because that is a particularly dangerous situation to be in. We've seen what's happened in Europe, in many countries around Europe, where there's been relaxed social behavior combined with people gathering in large groups. And in fact, in some countries in Europe, it's also been the return to nightlife that's actually been documented to contribute to the increase in cases. And those are the kinds of issues that as authorities we have to deal with. And we work with our local law enforcement officers to be able to try and contain it from that perspective.
When you look at the national picture, I beg your pardon, as far as infections just this week, I mean, the numbers from Wednesday night and Thursday, as far as the total tally of infections in all provinces, were above the 2,000 mark. Do you think we'll spend Christmas under stricter lockdown?
I hope not. I really hope not. But I'm afraid that if we are not going to change our behavior, and I think really all of these are lessons as a call to action for socially responsible behavior, we really have to begin acting responsibly. I'm afraid that if we don't, we might very well find ourselves where Europe is, and we might very well then find ourselves in more severe stricter lockdown regulations again.
Dr. Karim, hopefully the next time I see you will be on a beach in Cape Town and not under stricter lockdown. Thank you so much for speaking to us tonight. Dr. Sadiq Karim is with the Western Cape Health Department. He's the Chief Operations Officer there.